Okay, so Dr. Amin, one thing that really surprised me when I was speaking to you is learning how dentists, what they experience when they take CE courses, right? So you're telling me the story of how when you learned to do implants years ago, how you go into a classroom, they teach you a lot of theory, you practice on like models like typodonts, and they say, okay, well, you're good to go. You've learned. You're ready for implants. And maybe if you can convince somebody like your cousin, your friend, your mother to come in and do implants with you, you could do that during the course. But a lot of the time, it's like you don't actually get any patients unless you know how to find your own patients. You're not going to be provided with any patients. You simply learn a bunch of theory. You learn how to do it on like a simulation, and then you're good to go, except you're not really good to go. And a lot of dentists end up flying to Mexico or Dominican to actually get some real experience. And to me, when I was listening to that, it seemed really bizarre. It was so unorganized. And I just want you to kind of tell us, like, what was it like when you first started to learn implants, when you were going through the courses, when you wanted to offer this in your practice? What did you experience?
Okay, thank you, Nick, for for having me today. And yes, you forgot one thing about what we talk is the certificate. Once you get the certificate, you say,
Right.
okay, I am there. I am the hero. I can make it. So, I mean, back in the days like 2007 and 8, implant courses, they were really expensive. Only, we'll say, like only star implantologists will do these courses. So I decided to take my first course with, I remember with BioHorizon. It's one of the implant companies, a very successful implantologist. He passed away. His name is Carl Mish. He's a like really big star. He has many books and everything. So I decided to learn from those people, right? And when you read his book, his series of books actually in surgeries and prosthetics, it is very comprehensive and gives you lots of theory and understanding of the like the basics that you need before you go and drill, like as you said in the patient's mouth. That's what we call it. You drill a hole in a patient's mouth, right? So it was very successful experience to me. I learned a lot actually, though it was on either peg jaws or plastic typodonts that you drill a hole on the table.
So
And
like cadavers, you mean like the yeah.
cadavers, yes,
Yeah.
China cadavers at that time. And then you learn and you see all these beautiful cases done by those implantologists. Like they are really nice, beautiful. They have tons of experience, so it's just very simple to them. So they try to simplify the procedure to you. And once you're done with a 7-10 day course, then you'll say, okay, so I have done the drilling sequence. I have seen those SAR dentists, they were doing it, so I can do it for sure. And the moment you go there, it is a different world, really. So you go, you pick your friend, you pick your whoever relative wants to be the
let you experiment on it,
anything,
basically.
anything, and you start your sequence, and boom, first thing you know is okay. So where I am going to sit, and you start thinking, okay, I have to place it in this place at that position. But wait, where I'm gonna sit? Like, where should I? Like, should I be on the back? We call it 12th position or 9th position or 11, position. So
So that's because you learn on a table, right? You have a typodont. You're not actually. It doesn't simulate what it's like with a real patient in the chair.
Never simulating. And then you go and you place your implant, but it takes you like real effort, and the sweat, you can feel it under the mask and and the head cover. So you basically struggle and then you'll say, does it work really? Like, should I continue doing that? Because it's so much like effort. And then it comes to, okay, no, I spend that money, I spend that time. Let me continue, and I want to do that. I want to be successful in implants. And then it comes to who's going to bring you those patients? And then you get like there is no staff trained, right? Who's going to bring you those cases? It's your staff,
Right.
your hygienist, your front desk, your manager, how you advertise for yourself. So basically, you're stuck in a world where if you see some cases in the hygiene room where you have to have enough thickness of bone, and most of the cases, guess what? After removing or extracting a tooth, 3 to 4 months later, the patient loses 30% of the bone width, and you're stuck. Okay, so now what I'm gonna do? Like I need to place implants. So you have to start looking for those patients where they have like really the ideal things that you have learned into your course.
Like good case selection, right?
Good, yeah, exactly. Because you can't risk your cases. And then it comes to, oh, but that patient, he's a smoker. They told us in the course, do not place implants in the smoke back in the day. Because it reduces the success rate, which is like really, if you look into implant success rate, it's really interesting, 95, 97%. Now, the definition of success rate need to be clarified in these courses because yes, you get your implants, you found that ideal patient, you place your implant, but after all these struggles, they never taught you how to deal with that patient. What does compliance mean? What does success rate mean? In my dictionary, success rate means, and many implantologists as well, success rate means that implant stays in the patient's mouth more than 10 years. So success rate is not that this implant, okay, integrated, great, you place your implant, and that patient still not coming to the hygiene visit, still smoking. You still, see him like when he comes back after a year or two to fill another tooth, you see the plaque and calculus. So case selection.
Right.
Nobody told us. Nobody taught us how to look for the compliant patient beside the bone, beside the gum structure and everything. But patient compliance, patient attitude, patient selection, all these matters really to be like successful in implant dentistry.
Yeah, I mean, it sounds to me like it's like you learn the theory, you don't necessarily get the practical experience because if you're just practicing on a plastic model or a cadaver, that's not the same as a real patient that might be nervous or they're sitting in your chair. You're not really sure like where do I sit? How do I talk to them? How do I calm them down? It's probably hard to calm them down when you're nervous because it's like your actual first real case. But on top of that, to be successful with it's almost like, well, how are you going to get those patients? Like who's calling you? Just because you got a certificate on your wall saying you do implants doesn't mean the phone's going to ring because people want to do implants with you. How do your staff talk to patients about it, right? Because no one's going to walk in with a credit card and say, I'm ready for implants. They need to talk to the staff. They need to, have that treatment presentation. So that's not really covered. So it almost feels like they give you the 20% of the training where it's like, okay, you understand the theory and you understand the mechanical skills you need to kind of use. But all the other pieces that would dictate whether you really are successful in your practice doing implants, it's almost like, well, you need to figure that out on your own.
It is a struggle. And you mentioned very valid point because patients and anxiety will definitely become your own anxiety. Like their stress is your stress. So if you cannot manage these things in the beginning, you're out of the game, believe me. Like you cannot continue because you might be able to place here and there, but the number of implants, the number of successful cases of implants, it will be really not interested.